Cholera is caused by the bacterium known as Vibrio cholerae. It is passed from human feces into water when, for example, heavy flooding washes human feces into streams or rivers from which people get drinking water. It can also spread into food when human feces with the bacteria is touched and the hands not thoroughly washed before food or vegetables are prepared. The major symptoms of cholera include non-stop stooling and ceaseless vomiting, leading to general weakness of the body. For more clarity, I visited Queen's Specialist Hospital in Magodo, Lagos, where Dr. Oluwatobi Adeniji obliged my request for more explanations. He said cholera can be very deadly when not detected early.
The bacteria Vibrio cholerae produces a toxin. That toxin acts on the small intestine, on someone's gut, and increases the rate at which the person releases water. So that is what causes the diarrhea. So that person becomes dehydrated. And when you are dehydrated, there are a lot of things that can happen. Dehydration causes electrolyte imbalances. And when someone has electrolyte imbalances, it can be very fatal. It can be very deadly.
To find out if the people are aware of the outbreak of cholera in Lagos, I hit the roads to Surulere. I met with diverse reactions and lifestyles that could spread the disease quickly.
Do you know that cholera is spreading in Lagos?
No, I don't know about that.
It's hard to say because I've not seen it.
The little I know is a communicable disease.
As of the time of this report, official figures say 15 deaths have been recorded in Lagos State. To maintain safety from cholera, doctors say hands must be frequently washed, with the government steadily providing potable water. Food must be prepared by vendors under hygienic conditions. This is the Kilo area of Surulere, Lagos State. Some of the residents here know that cholera is spreading in Lagos. Some others say they do not know. But cholera gets very deadly when not detected on time and presented for medical intervention. Jacqueline Ogo, TVC News, Lagos.
Thanks to Jacqueline, and now to Dr. Mebawandu in studio. The Lagos, State Commissioner for Health, Professor Abayomi, he says Lagos Island has the, and I'm quoting directly here, has the highest number of suspected cholera cases, with 106 cases out of the 350 suspected cases in the state. So clearly, in another report, it talks about Lagos being the epicenter. Now, this particular infection, disease, is what in Yoruba land was known at one time as Aronigbameji. That is the disease that requires 2 calabashes. The implication being that one for vomiting, the other one for the business at the rear. So that was a long time ago. It has come back. What has happened? Do situations like that go dormant, and then conditions are such that they come back again?
Thank you, Okiori. Sometimes in 1817, the reservoir of cholera was actually the Bengal, West Basin, and Bangladesh.
Okay.
So throughout the world, we've had like 1, 2, 3, 4, 5, 6, 7, 8 pandemics spreading all over the world of cholera. All of them originating from India. All of them. So we're not part of this cholera ab initio until 1972, when now somebody imported cholera into Nigeria, and it was very devastating, killed people. Between 1972 and 1991, we were free. We were very happy. So
those were the years.
Yeah, those were the years. But 1991, the cholera came back. Now, after that, we started seeing from 2008, 2000. Subsequently, cholera first became every 4 years. Now it's an annual event. If we're not being careful, cholera can become even every other month. Nigeria is now endemic. Cholera is now endemic in Nigeria, as the case may be. Then the big question,
meaning that we don't even need help from outside anymore.
No, endemic means that it's perpetually here.
Oh dear.
It's perpetually residing with us. But why do we have cholera in perpetuity?
Okay.
Cholera can only happen when two conditions are fulfilled. When you breach the wash condition, water, sanitation, and hygiene condition, and when there's the cholera in the population. Even if you breach the wash condition and there's no cholera in your population, no, the germ is not in your population, you may not get cholera, you may get other thing.
Okay.
But the thing is that many Nigerians, 1 to 80% of them are even carrying the germs in their bowels. But note that even the presence of cholera in your body does not mean that you're going to have cholera.
Okay.
Because as much as 80% of people will not manifest, few people manifest in mild cases, it's only a very small population that shows that large number. So, and then the virus will still, the bacteria will still have to stay in your gut, even after an episode of cholera for the next 2 weeks. So it's key for us to understand these dynamics. So once we breach the wash condition, water, sanitation, and hygiene, we have problem. Now let's look at Nigeria, and before we come down to Lagos.
Okay.
Nigeria has 215 cubic kilometers of surface water and a lot of underground water, compared to South Africa with 49. So in essence, Nigeria will have a lot of water, okay? But the challenge has been with the management of that water. Supply, management, infrastructure, investment into the water to benefit the people. So that's another. The second thing is that...
Sorry, sir, before you leave that water business, are you talking about surface water? Because my mind went to wells and that.
No, surface. We were talking about surface water and underground water.
And underground water.
Nigeria has times 5 of South Africa. So some people, you have challenges with water that you have to process for people to drink.
Yes.
Nigeria is not having that challenge.
Okay.
We have challenge with the management of that water, with infrastructure, with investment, and with the law guiding the water usage.
My question, Doctor, is might wells be affected, since you said surface and underground?
Yes, of course. Yes, of course. We have to dig well. We're coming to that.
Okay.
We're coming to that. Now, out of this, access to clean water is only for 19% of Nigerians. After the water that you can drink, that you won't have problem. 19% of your population.
And is that government supplied?
Nigeria, the water, maybe from government, yes, exactly from government, or private setup that is good. Nigeria is the headquarter of open defecation. We poo-poo, on top of everywhere. Now, out of the 774 local governments in Nigeria, only 117 are free from open defecation. Interestingly, Lagos is not one of the... None of Lagos State local government is free from open defecation.
Yeah, there are so-called iconic pictures.
Go to Ikeja, go to VI, go to Lekki, go to everywhere. Everybody's defecating. In fact, Lagos Island as the epicenter is not surprising. Because everybody poo-poo on every surface.
Well, when you say everybody, we understand you're being hyperbolic.
Yes, let's get it straight. Yes. That's why, because, and then if you look at the sanitary condition of Lagos Island, now, access to hand washing. As much as 167 million Nigerians don't have access to hand washing. You don't wash your hand, okay? And then you look at the way the food is being supplied by the gutter, in open place, no monitoring, no nothing. Even somebody carrying all sorts of germs, you sell food to everybody. So when you now cook this thing, you look at it, and then when the rain now comes, it washes everything all over the place. You straddle, you walk in the water, you carry the water, you wash your teeth with the water of rain that has swept all the feces to contaminate other sources of water, food, fruits,
And
no doubt.
Exactly. Look at that. Is that brackish water? Or it's just black, and it's just black. And unfortunately, as you said, people use water anyhow. If it looks clear to the eye, you might have fruit vendors dipping their wares into this kind of a thing, saying that they're cleaning.
They're cleaning, they're washing. And indeed, every time in Lagos, you see people pushing carts, with water. What is the source of the water?
What is the source of
and that's what we have to drink. And then the borehole they are digging is shallow. The well they are digging is shallow because, you quickly meet water table in a place like Lagos.
Yes.
And when there's flood will just, wash your dirt.
Which is a...
And the gutters are open. So now in reality, the pursuit is actually to see that how to work local government by local government to see that we declare this local government open defecation free. We improve sanitation in this local government. We talk to school children. We go to the garages. We go to the food vendors and say that, listen, you cannot be selling food by gutter. You cannot even stay on the street and be selling food. These are for human consumption.
There are bookers in this town, in this city, where the patrons are sitting in the booker. There's the table there. There's the stool bench. The bench is here, and there's a gutter going underneath between the bench and the and the table.
Go to Lagos Island.
You see that?
So I'm not surprised that the highest number is coming from Lagos Island.
It certainly is an emergency. And when we now hear, talk to me a bit about the strains. They say the most virulent strain showed up in Lagos. Isn't cholera bad enough? It even has strains. Any one of them is going to take you out, perhaps.
If I'm saying I'm a Yoruba, for instance, we know we have different predilections. We have different characters, even different Yoruba. If you're an Abeokuta, if you're an Ijebu, if you're this or that, you see there are some traits that are peculiar to you. So even within the cholera family, there's those strains that I think the Inaba and Ogawa strains are quite very aggressive. Responsible for most of the epidemics. Now,
does aggressive mean it is more difficult
virulent,
more difficult to treat? Now, well, first of all, it's fast acting.
It's virulent, because what happens is that first and foremost, you must put cholera in your mouth.
Okay.
You must put the germ in your mouth. That's the first.
Okay.
Now, there's a dose-dependent type. There's a virulent-dependent type. When it enters the intestine, it colonizes the intestine and stimulates the intestine to produce a lot of water. And the intestine itself said, look, you are a stranger here. I must throw you out. And then start throwing the thing out, either as stooling, as vomiting.
So that's what ends up in vomiting and stooling.
You will not have fever. But the stooling and vomiting will be pervasive with body ache, serious body ache, muscle ache.
And if left untreated?
Of course, death. Now, the thing is this. What is more important is for us to honestly look at how to stop cholera. Now, it's a disease of poverty. You saw what is showing on your television. It's a disease of underdevelopment. It's a disease of poor governance. Let's be honest. It's a disease of poor governance. And, of course, driven by inequality, okay, driven by malnutrition. Nigeria is second number in the number of malnourished people in the world. These are not good statistics. We are the second number with open defecation, we're the poverty capita, we're the malnourishment capita. If you cook all these things together, why this thing will keep coming? Unfortunately for us, Nigeria has not exported cholera. But, India used to be the constant exporter of pandemic of cholera. And then, for us now, we should be able to do something so that we don't end up being the exporter of cholera. Okay. So now, and these things are quite simple. When the rain is coming, we usually send warning about flooding, protect your goods, this and that. Nice, good warning. We should also be sending warning concerning the health challenges that may come with rain.
Given our state of development.
Germs. The rain is coming, germs are coming. This is the way to behave when you have flooding, okay? This is the way to treat your water source. This is the way to further protect yourself because rain adds a lot of germ to it, or flooding. So indeed, we are not interrogating that. We're not discussing sincerely about how to reduce those type of things. And it's worrisome. So we would end up having repeated episodes of cholera. Then I'm not going to talk of water supply. I know that investment into water supply is very, very huge, and we've not been able to get it right. Yeah? I'm just surprised that Lagos, as a mega city, shouldn't be contending with repeated cholera outbreak like this. You government just go to do what they need to do. Now, a lot of people are flooding to Lagos, compromising the environment. You see, it's like also a battle between your environment, and you. Because when you neglect the environment will throw germs at you. It's as simple as that.
Doctor, just like when we had the coronavirus thing, the medical people, experts, were at pains to tell us that, at the end of the day, you could short-circuit the whole thing by doing some very simple things. And most hygiene was at the very top.
Indeed.
At the very, very top. Now, it seems that this is the same here. You're talking about access to hand washing. So would I be correct to say that at least maintaining this rigorous level of hand washing, for instance, because you've said that it has to go into your mouth.
Indeed.
It has to go into your mouth.
So,
a perfunctory, washing at the buka, a perfunctory 10-second washing at the buka, and then digging in, you might not have removed very, very much. So that's the kind of thing you're talking about that, in the case of cholera, I beg your pardon, in the case of the coronavirus, there was this whole matter about soap and water and setting it up at so many places. Effectively, we can take some of the infrastructure we had, especially in the simple hand-washing area. Is it not true that we can bring some of that to bear in this emergency that we have on our hands?
Indeed. I think the first thing is actually, we have to activate the local government. They are the closest to the people. They see the gutter, they see the sanitation situation, they see those people defecating openly, the absence of toilets, even in the car parks, are known to them. Okay? Now, the simple format is this. You are approaching your table to eat. The rule is that go wash your hand first. You have soap. If you're
That's
not,
an age-old.
If you have your soap and running water, unfortunately, there's no even water running again. But anyhow, wash your hand as you can. Maintain that hygiene in your kitchen in preparing the food. If you have to buy the fruit, wash the fruit properly before you start consuming.
When you say wash the fruit properly, this might be a new one to people who, for example, let me just, off the top of my head, a banana, for instance. So there you are. I'm just imagining this scenario where, for some reason, there is a cholera bacteria on the banana. You're peeling it with one hand. So, of course, that's protected by nature. But God forbid, you might infect that which was already infected. So, I don't know, this whole matter about, wash your fruit.
Wash your fruits. You already wash your fruit. It's very simple. Even that banana, before you touch the peeling system, wash it. Because quite a number of the infection of cholera is dose dependent.
Is dose dependent?
Yes. If the number is heavy, yes. Because the intestine itself, has a protection. There's acid being secreted by the stomach that kill a lot of germs that enter your mouth. Except you have challenges with like ulcer, and you're using proton pump inhibitors that will lower the ulcer, then the acid level.
So you can do a lot to reduce the dose.
Yes. So what we're doing, that by the time you wash even the banana, you've washed your hand, you wash the banana, you peel and put in your mouth, you've done a lot of dose reduction.
When people think that cooking will destroy any bacteria, are they somehow, taking a good idea and over paying too much attention to it?
Yeah, cooking is, fire is a wonderful sterilizer, for everything. Sunlight, fire, wonderful sterilizer. I mean, that's the cheapest we have anyway. So in reality, but you agree with me that access to source of fire, whether firewood or gas or electricity, could be a limiting factor. So anyhow, you have to do it. But looking at the rural people who may have challenges with all this and source of water, because I know even in this Lagos community that the water that is running in front of their house is what they pour on, and so they drink the water. So in that situation, you carry your campaign to that place, get a separate bucket, put water guard into it, put a cup on top of that bucket, keep the bucket clean, put a cup on that bucket. If you want to bail water, just take that cup, put water, and put for the one you drink and return. Before you refill the water again, clean just simple rules that
commonsensical ideas.
Then go back to primary school. Ingrain the culture of hand washing. Make it such that a school that does not have has hand washing protocol, proper protocol of hand washing, is brought back to understand the importance of that. Go back to those people that are doing food by the roadside. Of course, food inspection is key. Whether you have fast food or slow food or whatever. The food inspection is key. You understand? Look at those people. Are they carrier of germs that can, enter their kitchen and see how the food is being prepared? Those people selling food by the roadside, you may have to really raise a set of standard for them. And these are done at the local government. It's not, the environment is key. If our gutters is not covered and everything dropping and you pick it back and the water flowing and flow out from that gutter, you will transmit germs. Environment is fighting back. So again, you have to do standard of building. I agree, you must do that. Yeah. But more important is the fact that we have to touch those environmental issues that gives us diseases.
Indeed, and I imagine that government is going to be up to it if the whole Sanwo-Olu machinery with coronavirus, they must have a lot of knowledge in there that they are able to
We
deploy.
should extend it to a lot of these communicable diseases and then, be able to create a healthy Lagos. Yes, Lagos, beautiful building, tall, trying to build roads. I agree, no wahala. But we must create a healthy Lagos because the health of your population translates to your wealth.
Okay,
in a way, yes.
And so the more people know, so there are these campaigns.
Exactly.
Lagos is busy putting out this information as much as possible, but you've spoken about the rural areas being tremendously important. Right now, it's in newspapers, it's on television, it's on social media, efforts by the Lagos state government to sensitize the people. Yep. But we often hear that all well and good, but the rural areas where they don't have social media, they're not even interested.
For the past 3 days, I just came by yesterday. I had the opportunity to be on top of Lagos Lagoon and water, extended from Oriba down to Lugbokere. I had reason to be, frequenting those water places. Of course, in my little way, I, called the people together in balance and said, listen, we have cholera now. You know what cholera did to us in those days. We must take some steps. That's at my own personal level.
Yes.
So, but we must escalate it and make it a normal communication at those levels. Now, you guys don't have what source of water. Probably you are using this water. These are the steps you take to make this water safe, okay? And in reality, incentivizing, those kind of good behavior will tell. A little pictorial attachment somewhere will give them the guidance of what to do.
Some diagrams.
Take tiny money, buy your buckets, clean the bucket. Because at the end of the day, governance is about how well it touches people.
How long does it take for cholera to end up in a fatality from contact?
Few hours, if one ingests cholera now, few hours to about 5 days, that's the incubation period. Now,
So you might have it for 5 days and not know about it.
like I said, 80% may not even be so symptomatic, up to 80%. There are people that are carriers of cholera, it's inside there, residing there gently. Now, after that, you may have constitutional symptoms, body ache, headache, you say, okay, I'm a bit weak, and this and that.
Okay.
But the first thing, stooling starts.
That's the first thing.
Vomiting follows. You need 2 bowls to contain it.
That's where the Onigba made
Yeah,
came
2
from.
bowls, one in front,
One.
one behind. And then as you lose nutrients, water, body cramps, pains, restlessness, the cells stop functioning. They become deranged in function. And then before you know it, the person is dead. So it's a failed attempt by the body to try, because the body cannot generate water by itself. So you have to put water there. So it's a failed attempt by the body that, listen, I don't want this jam. Go. But
So
you have to replace the
you
water.
have to be
And then,
rehydrating.
very key is that I shouldn't see any primary school student that does not know how to prepare salt water solution, salt sugar solution.
Okay, that's very important. At the very simplest level.
That's how to really help your younger ones.
That's for rehydration, right?
Yes, for rehydration. When you're stooling, this is the water. If you cannot get ORS sachet that you put inside the stomach, this is a teaspoonful of sugar with teaspoonful of salt. You mix it in a clean water, and you drink as you throw out.
As you throw up.
So that could be a saving measure.
That's at the very, very basic level.
You don't even need to spend any money on that, apart from the communication and education and demonstration of that commitment. So let's first of all go back to those primary schools and ingrain proper culture for health. Hand washing, it does a lot of things. Hand is not just for prayer, and raising and doing that. But hand is also a kind of health.
Let me bring on Patrick, who has called in. Good morning, Patrick.
Good morning.
Thank you for calling in. Go ahead, please.
Yeah, this is Samuel from Surulere.
Oh, I'm so sorry. Samuel, not Patrick. Carry on, please.
Okay. Yeah, I just want to support what your speaker is saying,
Okay.
that this is also an evidence of bad governance. Take, for instance, I live in Surulere. Surulere used to be a kind of model for Lagos. For over 2 years now, you don't have pipe-borne water in Surulere again. We are told that your water dam is being worked upon and all of that. So, I mean, let alone Lagos Island. You feel Lagos Island is the London of Lagos in Broad Street. So by the time you come to Saleko, Kiaring, you see people washing and defecating and all of that. The government should take action to make sure pipe water is not a luxury. It's not only for GRA or anywhere else. It should be something that they should work upon. Thank you.
Thank you very much for calling in. Appreciate that call, which is, being back on King Lane. Everything that the doctor is saying in there, people need to pay attention. But I'm sure Lagos State, going from what we've seen of them, they're going to be all over this in terms of spreading the word. And apart from spreading the word, maybe also, not maybe, I'm sure, we'll be taking action to implement a lot of those things.
We should end open defecation.
Well, so those pictures that you see and that you smile whimsically,
yes.
of people,
look at the car parks, look at the car parks, look at the markets.
Yes.
Why should anybody run a car park without proper and well-maintained toilets? Why should anybody run a market without such a thing? Okay. Why should you have a public space where people have to, openly? Why can't we hold people responsible that we don't want to see this and this? Lagos must also be counted. How can Jigawa be having as much as 28 local government free from open defecation?
Yeah.
How can Katsina be having 28, 18, and Lagos has no single local government free from open defecation?
Okay.
Why should that be?
There's another caller on the line. I didn't catch your name. Good morning.
Good morning, Kuyori. My name is Wale. I'm also speaking from Surulere.
Good morning, Wale. Thank you for calling in.
Thank you very much. Of course, I would like to commend you for this very great effort. I have a concern.
Go ahead.
Yeah, thank you very much. I really don't know what's our challenge in this country, especially in terms of outbreaks. We are rather reactive than proactive. And I don't think that is good enough. I want to agree with your guest that this issue has to do with governance and enforcement. And we have not been taking these things very, very serious at all. So therefore, I remember with nostalgia when we were growing up in Surulere, we used to have wole wole. So why can't this be reintroduced again to ensure that all these issues about, outbreaks are addressed?
Exactly. Sanitary inspectors. Just for non-Yoruba speaking people.
Yes. I also remember then, even at the sight of wole coming ahead, you will have to run and tidy up your places. Now today in Surulere, and in fact, most part of Lagos, it's a mess. Health issues are no longer taken care of. They are ignored. So I think at this point, now because of the surge in mortality, now that is only when we come to react rather than being proactive.
Okay.
And when things, subside, then we are back to our normal ways of doing things. And I don't think this is right.
Okay.
This is not right at all.
Thank you.
Call also about the COVID. Now COVID is gone. Perhaps it's still particles of this here and there. And yet we are not compliant.
All right. Thank you very much, Wale. We've run out of time. I beg your pardon for interrupting you, but thank you very much. Appreciate your call. We've run out of time. And I must thank Dr. Tui Mebawondu as well, because viewers are calling in and saying, spot on. Dr. Tui Mebawondu, it's what we're talking about.
There are 3 areas. Let's now, while we've
run out of time.
We should look at 3 areas shortly.
Okay.
Now, personal hygiene, food hygiene, environmental hygiene.
Okay. Those 3.
Act at those levels.
All right.
Personally, with your food, in your environment. I think you'll be good.
It's a fine place to leave it. But of course, we'll keep updates going on as to what's going on, especially efforts of government and individuals to help us with this to the extent that we do need help. So thank you very much, Dr. Tui Mebawondu. Thank you for calling in too. And our thanks to the commissioner who called in earlier, Musa Ashams, that is from Plateau State. Okay, that's our program today.